Alexa Lopez. I'm a student physical therapist. May I please have your name and date of birth, please?
My name is Nelson Lopez. I was born on March 16 of 1988.
Hi Nelson, it's so nice to meet you. All right, so today we're going to go ahead and do our annual chest assessment. I've never got the pleasure of working with you. I know that you've been coming here for many years now. So go ahead and tell me a little bit about yourself.
I've been coming here for about 5 years, a little bit more, and I do about 4 treatments a year.
So I see here that your brother also has cystic fibrosis.
Yes, he has advanced cystic fibrosis. He's just had a double lung replacement.
Oh wow, is he doing okay?
Yes, he is doing a lot better.
Okay, well that's good to hear. Tell me, how is everything going at home? How's work going?
Home is doing good. I'm working from home.
Due to rapid onset of respiratory tract symptoms such as persistent cough, recurrent lung infiltrates, and shortness of breath, the patient was given a different brand of bronchodilators to add to his daily treatments during the chest vibrations.
Since the last time you came here about 3 months ago, so anything differently or things going the same?
No, everything is good. Everything's it's different, but it's going good.
Okay, good. No, nothing abnormal.
At this time, no.
Good. And I see here the last time that you have it listed that we had any sort of like abnormal like inflammation or anything like that was a while ago, right?
That's correct.
Okay. I also see here that you've had a past history of cholecystitis, probably like 4 months ago. How's that going?
Seems like been having problems with my gallbladder.
Yeah, exactly. So, but we have, the treatment was, you have no adverse issues with that? I know that was a while ago. Do we have any issues currently?
Gastrointestinal system complications such as this are possible and highly likely with cystic fibrosis. Abnormalities in the intestinal tract, pancreas insufficiencies will lead to nutrient malabsorptions. During the observation portion, look for signs and symptoms of vitamin deficiencies.
Okay. And any pain during any of that? Anything like anything like blood or anything that you see?
No, at the moment, no, I have not seen that.
Okay, good. All right. Okay, Nelson. So the next portion of this examination is going to be with observation. And for the remainder of this time, I'm going to let you go ahead and have your shirt removed. If you're uncomfortable with this, I can go ahead and grab you a gown so we can go ahead and do some draping.
No, I'm fine. I can remove it.
Okay. Can I have you extend your arms out, please? Good. Go ahead and chain your arms over, please. Very good. And your arms by your side, please. Go ahead and take a deep inhale for me, please. And relax and exhale. Very good. Maybe could you move your glasses for me, please?
Okay.
Very good. Smile. Very good. Okay, Nelson. Go ahead and extend your arms out for me again, please. Turn around, please. Go ahead and have your arm on your leg, please. And the next thing I would like to do is assess some vitals. So I'm going to be taking your pulse. So have your arm out as such.
The pulse was at 72 beats per minute, with the rhythm being regular and the quality at 3+. While taking the pulse, respiration patterns are being assessed to detect any labored breathing. He was at 72 breaths per minute, with the depth and rhythm being regular. This can be seen as mild tachypnea. Pulses are assessed in the lower extremity bilaterally. The calves in the lower extremities should be observed for any skin color changes or any fluid retention.
We'll also check your pulse on the opposite side. Very good. Okay, Nelson, the next thing I'm going to go ahead and do is a super pressure. Have you ever had before?
Yes.
Very good. Okay, so your left arm, please. Ready?
Yep.
The patient's blood pressure was marked at 128/87, putting him at prehypertension.
I'm going to assess the position of your trachea. So I'm going to have to put my hands by your throat. If at any time you're uncomfortable, just let me know, okay?
Okay.
The trachea showed no signs of deviations. It sat in a normal position in between the mediastinum.
I'm just going to go ahead and put my hands on your chest, and I'm just going to go ahead and feel for some specific areas.
Palpating over the mediastinum, chest wall, costal cartilages, I'm checking for any crepitus, abnormalities, or any signs of discomfort from the patient. Assessing bilaterally, he showed increased anterior-posterior diameter of the chest wall. This can cause hypertrophy of the respiratory accessory muscles due to overwork. The costal angle is above the 90 degrees, confirming that the patient shows increased diameter of the chest wall.
Nelson, now let's tap on different portions of your chest, okay?
Okay.
Over the upper lobes of the third intercostal space, a small, dull sound is produced with percussion.
Here you go. Okay. I'm now going to put my hand on different placements of your chest, and I would like you to go ahead and repeat the letters 99, okay? Numbers, I should say.
99, 99, 99, 99, 99.
In the upper left lobe, increased fremitus was palpated, confirming suspicions of consolidations.
Okay, Nelson, so now I'm going to be listening to the sounds of your chest. I'm going to be placing my stethoscope on different portions, but just breathe normally, okay? Out of your mouth.
Wheezes were heard on the expiration at a constant pitch, but the durations varied. There was decreased intensity in the breath sounds bilaterally in the upper lobes. This correlates with the degree of hyperinflation present in cystic fibrosis.
I'm going to be having you this time say some different things. The first one I'm going to have you say is 99, okay? So whenever you feel my stethoscope, I would like you to please say 99.
99, 99, 99, 99, 99, 99.
Okay, very good. And now, Nelson, the next thing I'd like you to do is I would like you to whisper 1, 2, 3 whenever you feel my stethoscope, okay?
1, 2, 3.
So I'd like you to whisper it, okay? So 1, 2,
1, 2, 3.
3, whisper. There you go.
When assessing the patient's sound transmission, abnormalities were detected. Weaker, softer sounds were heard. This shows that there is a presence of hyperinflation in the lungs.
E, 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 E.
Very good. Next component, I'm actually going to have you turn around and we're going to go ahead and assess the back side of your chest, okay? I'm going to go ahead and put my hands on your back and I'm just going to feel for anything abnormal or let me know if you feel anything that is painful, okay? Okay, Nelson. So I'm going to put my hands on the back side of your chest wall. So when you feel my hands, don't be surprised, okay? I'm just going to be putting it right here. Make sure you're naturally breathing normally. Very good. And now I'm gonna go ahead and put my hands on your back and I'm just gonna be listening to some sounds. I would like you to please go ahead and take a deep inhale, and I would like you to hold it, please. Whenever you're ready. Take a deep inhale.
Yep.
Take a deep one, deep, 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 fill up your lungs and hold. Very good. And you can go ahead and relax.
Nelson's diaphragmatic excursions measured at 2 centimeters. This is below normal. This shows signs of chronic obstructive lung disease because of the hyperinflation of the chest and the flattened diaphragm.
Okay? So whenever you're ready, go ahead and tell me. And exhale. And hold. Very good. And you can breathe. Very good. Go ahead, repeat the letters 99 for the numbers. Repeat the same letters. Go ahead. 99.
99, 99, 99, 99, 99, 99, 99.
Very good. And now, Nelson, I'm going to go ahead and repeat listening to the sounds of your breath, but now on the back side, okay?
Okay.
So just breathe naturally, okay?
Tympanic sounds are heard throughout the lungs bilaterally. This is a positive sign that they are hyperinflated, which again is common with cystic fibrosis.
And now we're going to go ahead and listen to the sounds. But again, I'm going to have you repeat those different terms, okay? So, remember the first one, I'm going to have you say 99. Go ahead, whenever you're ready.
99, 99, 99, 99, 99, 99.
Very good. And now what I'd like you to do is whisper, remember, 1, 2, 3. Whenever you go inside, so. Whisper.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
And now for the last one, I'm going to go ahead and I'll have you repeat the letter E. Whenever you go inside, so go ahead.
E, 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 E.
Here we go. I'm going to put my hands on your chest, and I'm going to utilize this tape measure, and I'm going to wrap it around your chest, and I'm going to go ahead and get some different measurements when you take a deep inhale, and when you take a
Dynamic lung volumes are reflected by the magnitude of the thoracic excursion measurements. The first measurement being done is at the zygomatic process, or at T10.
You just confirm this looks straight, which it does. And okay, Nelson, whenever you're ready, I want you to take a deep inhale. Hold, deep, 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 as much as you can, and release. Very good. And release as much as you can. Whenever you're ready, you can go ahead and breathe naturally. Take a breath normally. So we got your deep inhale. Numbers now would like you to go ahead, and whenever you're ready, take a deep exhale. And exhale. All the way out, all the way out, all the way out. As much as you can, as much as you can, as much as you can.
A second measurement is done at the axillary level, or at T5 spinous process.
Good. Now let's go ahead and raise your arms one more time.
Patients with adult cystic fibrosis usually present with hyperinflation. This leads to more costosternal breathing pattern at that axillary level and less thoracic excursions at the xiphoid process level. This can lead to increased air trapping, which is associated with the decreased thoracic excursions.
Exhale, you got it. And good job. Very good. Good job.
Due to the high production of mucosine in cystic fibrosis, the patient's secretions should be assessed, describing the quantity, the color, the smell, asking them if it's consistent with their normal.